positively impact on the lives of women and children.
Do her work effectively. Look at any other institution that is being run by a woman. They've done very well. Women are not corrupt. Women are people who are straightforward. Women always want to do their work the right way. And it stands for advisors. Women are advisors. That's right. We advise our colleagues, we advise our husbands, we advise our leadership. But the problem that we have is that the advice that we give in the majority of cases comes in through this ear and it goes out through the other ear. This is why we have so many problems in Africa. I'm saying in the majority of cases. I'm not saying it happens all the time. But in the majority of cases, it comes in there and it goes out there. That's A. N stands for nation builders. Women are nation builders. Women carry babies for 9 months. They give birth to them. They nurture them to be who they are. You are who you are today because of your mother. We have met their excellencies, their presidents. They are here because of their mothers.
HIV/AIDS was a development issue that gained prominence during this meeting. Dr. Michael Sidibe, the man who heads UNAIDS, believed the post-2015 development agenda cannot be achieved without placing women at the center of their approach.
The state, he introduced what we are all fighting for today, universal access to treatment. He gave free medicine to people who are living with HIV in his state, and it's also subsidized those people were not able to take the medicine because they were not having access to food by giving them a minimum of revenue monthly to be able to cope with that. So your presence today is just the continuation of what you have been starting when you were already governor of state. This meeting is timely. It's timely because you have the President Sirleaf talking about post-2015. We will not really make post-2015 what we want without placing the women at the center of our approach. And this meeting is about reflecting on our progress, taking stock of what has been done, what we have not been able to achieve, and trying to make sure that we will accelerate our effort and not abandon the unfinished business.
For the Nigerian finance minister and one-time managing director of World Bank, this platform was not just a meeting, but a social movement.
The 34 million people living with HIV across the world at the end of 2011, 69% live in Africa. Around 1 in 20 adults on the continent are living with HIV. And women and young people, as we heard, are especially vulnerable. And according to the latest statistics we heard from UNAIDS, women comprise 50% of those living with HIV. But there are some evident differences between women and men in the underlying mechanisms of HIV/AIDS infection and the social and economic consequences. These stem from biology, sexual behaviors, and socially constructed gender differences between women and men in their roles and responsibilities, access to resources and decision-making power. Today, young women represent the group most susceptible to be infected with HIV/AIDS in Africa, accounting for 67% of all new cases of people aged between 15 and 24. There's clearly a need to address the cultural and structural inequalities which persist for girls and women in order to make significant progress on this issue in Africa. It is both a moral imperative and an economic necessity. It's in this respect that I applaud the effort of our special guest of honor and patron of Global Power Women Network, Professor Joyce Banda of Malawi, as the chair of a very important new initiative established to move the HIV and AIDS and global health agenda beyond the MDG6 reference. The UNAIDS and Lancet Commission from AIDS to Sustainable Health is to explore the post-2015 agenda of AIDS and global health.
Malawian President Dr. Joyce Banda said this gathering presented them an opportunity to shape the future of HIV/AIDS and that Africa needs to pay more attention to girls' education if women are to be economically empowered.
Not taken for granted, but it really reflects the good character of my brother Goodluck Jonathan that are here to provide the much needed support to amplifying the call for accelerating action for women empowerment and gender equality in the area of HIV and sexual reproductive health and rights. I also salute the women that form this powerful network for the courage and determination to shape our destiny. Indeed, nothing for us without us. But I have said that time has come that we must, whatever we do, work with our men. For a long time, we were talking to ourselves. So we would meet women full in a room like this, come up with the resolutions, and they ended up nowhere because we had left our brothers outside. Distinguished ladies and gentlemen, at our inaugural high-level meeting in Harare, we adopted the UNAIDS call for getting to zero to halt the spread of HIV infection and mitigate the impact of the epidemic on women and girls living with and affected by HIV in support of the 2011 political declaration on HIV/AIDS. We specifically called for zero new HIV infections, zero maternal and child mortality, zero tolerance to violence against women and girls, and zero hunger and poverty. In my opinion, this Harare call is the ultimate goal that we should still aim for and demand. It is still pressing today as it was then when we last met. Therefore, my submission is that the Harare call for getting to zero should be the lens through which we explore our theme for this second meeting: accelerating implementation of the global and regional agendas for women and girls, gender equality and HIV/AIDS in Africa, and the adoption of key post-2015 priorities.
The Vice President and Women's Affairs Minister, Ajah Dr. Aissatou Njie Seydi, who headed the Gambian delegation to Abuja, tabled a country perspective on the bottlenecks and opportunities for attaining health